This is Dr. Gay. I want to say thank you so much for coming in today. And now I'd like to show you why your back is hurting so bad. It's because you have a disc herniation, which I'm sure you know clinically, but it's down here at this level. This is L5, the bottom of the lumbar spine, and this is the sacrum, the top of the sacrum, and the disc herniation is from this disc. So just to get the anatomy so it makes more sense, this is a view where the bones are bright. So this is L3, here's L2, L1. This is the top of the lumbar spine. This is the bottom, and this is the sacrum. Your belly button is right over here on the left. Here's the table you're laying on, so you're looking in profile at yourself. And on this view, we see the bones. You can see that they're separated by these horizontal gray things. These are the soft cushions, or the discs. So the discs are filled with a jelly-like material, and this is a bone in front, and this is a spinous process in back. So another piece of bone. So bone wraps all the way around the spinal canal, which is right here, and the spinal canal is filled with fluid, and the fluid is dark on this view. And the disc material is also relatively dark, so it's hard to see the difference on this. If we roll off to the sides, we see these openings called the foramina. At each disc level, you see a vertebral body, you see this thing looping over the top, the superior articulating facet, the inferior facet from here, and they lock together to the facet joint here. So these are locked together in back. If we roll off to the right and left sides, and these facets all look pretty good actually, and all the discs look pretty tall, which is good. But you have a disc herniation down here that's causing the trouble. Now we're going to go to another view where fluid is going to be white. So right now the fluid is dark. Can't see contrast as well, but when we put the fluid white, things really stand out. You can see the nerves like little strings of spaghetti coming down through here. You can see them going through these openings, and now we can find the problem. Down here you notice that these vertebral bodies are not really dark. There's brightness, and that is related to degenerative arthritis, like an erosion. So normally the bone should be really dark like this, but instead it's kind of foggy and bright. That means you have arthritis, little cortical erosion. That'll cause really bad low back pain. But on the left-hand side, we'll put up this other view again and look at that. This is the middle. You can see the disc herniation starting there. If we go to the right-hand side, this is the disc here. We see the erosions of the vertebral end plates that can cause pain. And the foramen, you could argue, is a little narrow, but not a significant stenosis. But if we go to the left, you can see that dark glob. That's disc material that's spilled out, and now it's going down. I measured it about 1.5 centimeter from top to bottom. And on you can also note that the disc extruded fragment is right here, and this is the disc right here. So it looks like there's like a little gap between them. And whenever they're discontinuous or this separated a little bit, we call that a sequestered disc. So the disc squirted out, and now it's separated. Sometimes these discs that are sequestered, they'll go and look at the disc and see it, and they won't know to look below it to find the disc herniation. So we mentioned that it may be sequestered, so they got to look down below to see if they find it. But this is a pretty big disc herniation, and it pushes on the nerves going down there. I'll put up this view. This is a view looking in short axis, going down, down, down. Excuse me. This is what we want to see, a big, wide open spinal canal filled with white fluid. We want to see these little tiny dots, the nerves in there looking good. Here's the disc looking good. Left facet, right facet. This is at the L4-5 level. Now we're going to go down to the abnormal level, down, down, down. You're going to see over here what happens, right? Here it's starting to come in, and then you can see darkness here, and right there measured that disc herniation. So a big herniation that squirted out going down. You can see your right S1 nerve, the sciatic nerve, is right there, and the left sciatic nerve should be here, but instead it's back here someplace. So big disc herniation is pushing on that left sciatic nerve, so it causes terrible back pain, as you know, and left sciatica, and also the nerves that are lower down are getting pushed back. Here's a nerve here on the right, a nerve here on the left, and these nerves are pushed back here too. So large extruded disc fragment that would probably need to have surgery, so you need to go as soon as you can in to see hopefully a surgeon, and they'll go in there and be able to get this out and get you some relief. But I don't think that physical therapy or anything else is going to help too much, because the disc herniation is so big and it's really pushing on this left S1 nerve, which causes severe sciatica. And that's it. Thank you so much.